Hi, good afternoon. My name is Walt Mabe. I'm the chairman of the board for Warren County Board of Supervisors. And today we're going to talk about Executive Order number 63. With us we've got Mr. Bell, the Commonwealth Attorney, and Mr. Farrell. He's our coordinator for the Executive Management Group. And I'm going to spend a few minutes after they speak because they've got a lot of information to give, and I'm going to talk very briefly about volunteering and having the people of the community giving back in the best way that they can while they have the ability to do it. So I'm going to turn it over to Mr. Farrell first.
Sir, thank you, sir. And my glasses get all fogged up, so I can't read without it. All right, well, good afternoon, everyone. My name is Rick Farrell, and I'm the Deputy Emergency Coordinator for Warren County. I want to provide you this afternoon with a brief update on two things related to the coronavirus. Our Lord Fairfax District caseload and what's going on around us regionally related to reopening plans. And when I'm finished, Mr. Bell will address Executive Order 63 regarding the wearing of masks in public and indoor places. As of today, there are 1,279 confirmed COVID-19 cases in the Lord Fairfax Health District. Clark County has 24, Fredericks at 319, Page 213, Shenandoah 414. Warren County has 141. That's a 12 increase from yesterday. 14 of our folks are or were hospitalized, and unfortunately 2 deaths are attributed to the county. And the city of Winchester has 168 cases. For your awareness, we do have a COVID outbreak at the RSW Regional Jail. At least 2 confirmed lab cases are required to classify an outbreak at the same facility type. For VDH tracking purposes, the RSW inmates are counted in the Warren County case numbers, and the RSW staff members are counted in their home of record locality. So for us, that jump is mostly attributed to the inmates that tested positive at RSW because of the way they count the numbers. This situation is being appropriately addressed and closely monitored by the RSW administration and staff, the VDH Lord Fairfax Health District, Valley Health, Warren County Emergency Management, and the Virginia Department of Emergency Management is providing and coordinating timely assistance as requested. Tomorrow, May 29th, all Northern Virginia localities, the City of Richmond, Accomack County, Virginia, and Washington, D.C. will transition to Phase 1. Executive Order 63 and Order of Public Health Emergency 5, which is the requirement to wear a face covering while inside buildings, is also in effect. On June 5th, Pennsylvania's stay-at-home order is expected to end, allowing the state's remaining red phase counties to enter into the initial yellow phase of reopening from the coronavirus shutdown. On June 8th, the final week of the West Virginia Strong, the comeback, is expected to begin. By mid-June, here in Warren County and the town of Front Royal, we anticipate opening the remainder of the county and town offices in conjunction with the governor's approval of Phase 2. Maryland is still moving towards Stage 1 of Maryland Strong Roadmap to Recovery. I ask everyone to remain vigilant as we venture outside our homes and support our local establishments over the next few months. We're still in this for the long haul, and everyone should reasonably have the effects of this virus to last through the summer. One of the models that I recently looked at, the IHME model, has us showing at the bottom of this sometime in August. Thank you all for what you're doing to support our community. Stay healthy, take care, and God bless.
Thank you, Mr. Farrell. Mr. Bell, would you like to speak a little on Executive Order number 63?
Thank you, Mr. May. Executive Order 63 is the latest executive order to come out of the governor's office, and it mandates wearing a face covering while inside public buildings. I've already heard a fair amount of misinformation about this. There are some things it does require, some things it doesn't. The enforcement mechanism is a little different than the enforcement mechanism for some of the previous mandates from the governor. But before we get into the text of 63, I would note that at the same time he entered Executive Order 63, he amended Executive Order 51. That is the original declaration of a state of emergency. And that originally had a concluding date on it. It's been amended now, so it is an open-ended date. Shall remain in full force and effect until amended or rescinded by further executive order. So right now we are under a state of health emergency until the governor's office says otherwise. So those of us who are looking for a particular end date for the emergency, there isn't one. But back to 63. First of all, 63 does not require you to wear a mask at home. It doesn't require you to wear a mask when you're riding around in your car. It doesn't require you to wear a mask when you're back by yourself in your office, in your own workplace. It doesn't require people to wear a mask 24/7 in any location. The requirement says that all patrons in the Commonwealth aged 10 or over shall, when entering, exiting, traveling through, and spending time inside the settings listed below, cover their mouth and nose with a face covering as described and recommended by the CDC. That's the Center for Disease Control. And it lists 7 different locations, or classes of location. One is the personal care and grooming businesses, your barber shops, your beauty shops, tanning salons, so forth, as those open up. If you're getting your hair cut, you need a mask on. All right, both in essential and non-essential brick and mortar retail businesses. You're supposed to wear a mask while you're going in and out shopping in the store. Food and beverage establishments, including but not limited to restaurants, food courts, breweries, wineries, etc., when permitted to reopen for indoor dining. Now, of course, nobody expects you to wear the mask while you're actually eating, but when you're waiting to get seated at your table, when you're walking to your table, when you get up and walk to the bathroom and back, you're supposed to be wearing the mask on. Entertainment businesses. Most of those are still shut down under the government's current order, but when they reopen, they're going to require a mask. So if you go to a movie when the movie theaters are reopened, you're supposed to be wearing a face covering while you're doing that. Also, face coverings are going to be required outdoors at recreational businesses that are open if you can't maintain the 6 feet social distance. Train stations, bus stations, taxis, Ubers, whatever, you're supposed to be wearing a mask when you're doing those. Any other indoor place shared by groups of people who are in close proximity to each other. This restriction does not apply to persons who are in their residence. Face coverings may be removed to participate in a religious ritual, i.e. you can take communion. All right, and state or local government buildings when accessed for the purposes of securing public services. What that means in English is when you come in to pay your taxes, when you go in to get a building permit, when you go in to yell at your local government officials, you've got to yell through a face mask. Now, enforcement. Most of the other requirements have been labeled as Class 1 misdemeanors, and any law enforcement officer can enforce a Class 1 misdemeanor. Now, the governor in this executive order says this one is still a misdemeanor, but the guidance given by the governor's office is that law enforcement is not going to enforce the mask requirement. It's going to be left up to the health department, along the lines with other kinds of regulations. So instead of no shirt, no shoes, no service, it's going to be no shirt, no shoes, no mask, no service. I personally intend on wearing my mask when I go into businesses and grocery stores because our businesses have had a hard enough time. I'm not going to put them crossways with the health department. Now, there are exemptions to wearing the mask even under these particular circumstances where it's otherwise required. One is while eating or drinking. That's obvious, we've mentioned that before. 2, if you're actually using exercise equipment, when that opens up, you're not required to use it. Now, any person who has trouble breathing, unconscious, incapacitated, or otherwise unable to remove the face covering without assistance, you're not breaking any laws. That's kind of common sense. When temporary removal of the face covering is necessary to secure government or medical services, and this is the most important one. Persons with health conditions that prohibit wearing a face covering. Nothing in this order shall require the use of a face covering by any person for whom doing so would be contrary to his or her health or safety because of a medical condition. Yeah, so if you have asthma, you're not required to wear a mask. If you have very bad postnasal drip, where you can't breathe with something covering and getting soaked, you are not required to wear a mask. Basically, if that mask interferes with your breathing or your health, you are not required to wear it. And you don't need documentation to do that. The executive order goes on to say that any person who declines to wear a face covering because of a medical condition shall not be required to produce or carry medical documentation verifying the stated condition, nor shall the person be required to identify the precise underlying medical condition. So in the governor's order, we basically have don't mask, don't tell. And that's essentially the sum of it. The enforcement is going to be done through the Department of Labor and Industry, through the Health Department, rather than a police officer is not going to stop you on the street if you're walking into a store without a mask on. That's not their job. But that business that is just now reopening and getting back to business may suffer some repercussions from the Health Department if you go in not masked. And Lord knows our businesses have suffered enough already. So as I said, I'm going to wear mine when we go into that situation. So that is the brief version of the updates. As said before, if you go to the governor's website, if you go to the state health department's website, there are information on all of these things and a very extensive frequently asked questions section that can give a little more interpretation as to how these are applied in different aspects. That's easy to find, virginia.gov, and it will direct you to almost any particular question you need answered about this. And as always, if you have a business or if you're a citizen with a question about this, you can call the Commonwealth Attorney's Office. We'll do our best to help out. Thank you.
Thank you, Mr. Bell. I appreciate it. In talking about the Executive Order number 63 and also about our safety issues, one of the things that keeps coming to my mind is the amount of people that are not doing what they were doing at one time before this. Meaning, like the people at CCAP, we had lots of people up there working diligently on Mondays and Wednesdays giving out food to anybody that drove up. We have a fear now of not being able to do that. So our volunteer base has fallen by the wayside. The government center, we normally have people that are volunteers that try to help out just in our offices here. The town, I'm sure, has the same thing. We have to look in the places that we are not employing people, but we can have volunteers that want to do things to help. And you can help in so many ways. CCAP, as a good example, when we're giving out food on Mondays and Wednesdays from 9 to 12, to be there just to deliver food and put it inside people's cars. One person or two people can't do it all and keep food coming in and out of the building. There's got to be people there to help. Our churches need to have delivery drivers to deliver food. Our civic organizations, they need somebody maybe because they have cut their budgets down to the bare bones. When they do that, they need people to actually help. I mean, there's somebody that may need an assistant that they can't afford to pay that will help clean up their facility when people go in and out. County needs that. Town needs that. And I'm not saying anything. People are hurting everywhere. We look for places to help. We've got some free time for those people that are not working right now. Now might be the time for you to look at your resume. Time to rebuild it up, because, you know, there's some of you, I'm sure, that probably don't know whether you've got a job or not when you go back. There's going to be a lot more telecommuting or telemarketing or telelegal work or whatever it is. There's going to be a lot more of that going on, and you've got to be prepared for that. You've got the opportunity now to start boosting your eligibility and creativity and to be able to do more to help our communities. I suggest that we all do something to help our neighbor. That's volunteering. Look at the Victory Garden. They may still need people. And when they're going to be producing some vegetables for people that need it. I'm glad for it. I'm trying to get every one of our districts to look at where can we put a Victory Garden in our district next year. We've proven that one will work. Now let's do it 7 times or 6 times or 5 times. It'll work. It's a good thing. That's about all I have to say. I just want our citizens to do everything that they can, just like I want to believe, and I see it every day, our government is doing the best that it can. We don't have all of the answers, but we're learning them as we go. And as we learn them, we're trying to pass them on. That's why we have these meetings here every Thursday that we can, so we can give out something good. And we want to help each other. So thank you very much. I hope you have a good afternoon and a good evening, and we'll talk to you again next week. Question?
Roger McGee, Royal Examiner. Mr. Bell, the requirement not to wear a mask in a gym when you're using equipment seems a little counterintuitive, because you start breathing harder, spreading stuff out. Are there larger social distancing requirements tied to that?
Yes, there is. As a matter of fact, for the exercise exemption, they're asking for a 10-foot social distance on it. That goes back to one of the previous executive orders that put us into phase 1.
So the health department will be the one that is enforcing this order. Are law enforcement officials not allowed to, or that direction from the governor's office, is that a suggestion, or is that saying law enforcement officers, you are not allowed to write a ticket for someone not wearing a mask?
That's one of the gray areas. Now, in the governor's remarks when he introduced the executive order, he specifically said this will not be enforced by law enforcement. It will be enforced by the health department. And when we get to the enforcement provisions, it says the health department shall enforce, but there is no prohibition against the local law enforcement writing a ticket for it, because it comes under the general violate the executive order class 1 misdemeanor. Now, I have already discussed this with local law enforcement, and we intend to abide by the governor's guidelines on this, and we will not be enforcing that. So, at least in Warren County, do not worry about getting a ticket for walking out without a mask. It's not banned, but it is not required by the governor's office. It is not the wish of the governor's office that law enforcement enforce this executive order, and we're going to abide by that.
I do have one more question. I don't know that you have the answer to this. The governor didn't seem to have much of an answer to this when he was asked on Tuesday. What kind of power does the Department of Health have to enforce this? Would this be a fine for businesses? Would they be able to come in and shut a business down if people are not wearing a mask indoors? Do you know?
Let's see. There is actually, take a look.
I think there was a reference somewhere that talked about citing business.
There is, okay. the Virginia Department of Health shall have the authority to enforce this order. Any willful violation, refusal, failure, or neglect to comply with this order pursuant to 32.1-13 of the Code of Virginia is punishable as a Class 1 misdemeanor. The State Health Department may also seek injunctive relief in circuit court for violation of this order pursuant to 32.1-27 of the Code of Virginia. No minor shall be subject to criminal penalty for failure to wear a face covering. Adults should use best judgment and so forth. It implicates that adults could be subject to criminal penalties by saying minors are not, but the health department does not have arrest powers. Yeah, so that's why I say the governor's executive orders have not always been models of clarity, and this particular aspect of this is less so than most. That's why I say we're following the verbal direction from the governor's office that this is not going to be a matter for law enforcement, criminal enforcement on it, though the executive order itself doesn't say that. But the health department, just like, can go to court and enjoin a business which is not following the requirement from operating.
Okay.
Yeah.
Any additional questions? Thank you very much for joining. I hope everybody has a good afternoon. Thank you.